last year in 2023, the Gender Social Norms Index, or the GSNI, conducted a worldwide study that found that 90 people, just like across the globe, have some form of gender bias against women. So a lot of the time when we talk about sexism, we're talking about like social issues or like just like general mistreatment, but this is an issue like in the institution of medicine that nobody really talks about. And if you know me, you know I've wanted to be a doctor my whole life, so this matters to me. But it should matter to you because healthcare can't progress until it progresses equally for all. And it should matter to you if you're a woman because this affects you. And it should matter to you if you're a man because wives, sisters, daughters, like this will affect them. So I'm going to talk about the sexist history of medicine, and then I'm going to talk about obstetric harm or harm to pregnant women, and then withholding information from women, harm to minority groups, harmful research practices, and then sexist expectations for behavior from female patients. So the first distinction that was ever drawn medically between men and women was on the basis of reproductive organs, which Dr. Marique Big, who has a PhD in sociology on this specific topic, she said that close association between women and childbearing, so close that her body disappears into her womb, has become synonymous with reproductive potential. So basically women from the beginning of medicine were defined as nothing more than uteri, which is actually really funny. This quote right here is from one of the first psychiatric writings, and it defines women as, quote, breeders and bearers, potentially warm-hearted creatures, but primarily simple, cranky children with uteri, forever mourning the loss of male organs and a male identity. And that's a direct quote from a textbook. So when you're working with an institution and its founding documents and textbooks define women as that, it's not a surprise that, like, you know, the first psychiatric like disease, I guess, attributed to women was hysteria. And hystero is the Greek prefix for uterus. So they essentially thought women who were emotional had their uteri floating around in their bodies, and the obviously male doctors would sexually violate them to fix this for them. So that was a early medically sanctioned just violation of women to make them less emotional. And then you get to lobotomies in the 20th century. So I'm not gonna like invalidate the experience of men who had a lobotomy, but 75% of lobotomies were performed on women. And they were performed on women who were emotional or nervously tense or had anxiety. The founder of lobotomy, Dr. Walter Freeman, would receive reviews from husbands for whom he performed lobotomy on their wives. And one such review said that his wife was more comfortable, docile, and normal than she had ever been. So if you're not familiar with the lobotomy procedure, it's the insertion of, it used to be an ice pick, or just like something like an ice pick, into like the hole of your eye right here. And they would sweep it back and forth, disconnecting the frontal lobe from the brain, so that women, specifically majority women, but also sometimes men, would be more docile and submissive. So this is that. It's pretty barbaric, and I'm going to move on past that, but yeah. So obstetric iatrogenesis, that's like a whole thing, but obstetrics is pregnant women, and iatrogenesis is defined as harm done to a patient by a medical provider that is not typically a course of the disease. So harm that's done by incorrect treatment. So this is defined as physical violence, verbal and emotional violence, which is non-dignified and disrespectful care, which I'll get into more later. Violence in the form of unnecessary medical technology, such as C-section.
Can you please have Joseph go to the college and academic planning office?
Yes.
Such as C-section and episiotomy, and structural violence embedded in system inadequacies. So the one I'm going to focus on is C-sections. So C-sections are a highly invasive procedure. They cut through your entire abdomen to get the baby out, and a lot of the times it's medically indicated, and it's really beautiful that we can do that to, save the lives of babies that otherwise might not make it. But there is a troubling tendency for physicians to perform C-sections for the sake of physician convenience. A lot of the time it's not medically indicated, and physicians will perform a C-section and not fully inform the mother that she doesn't really need it for the sake of just getting the baby out so the physician can move on to the next case. So there's also a troubling tendency in public health literature for women to be represented as passive victims of obstetric violence and have a lack of engagement with questions of resistance and agency. So a lot of the time, physicians will perform a C-section, not fully inform the woman, because women are portrayed in medical school textbooks as just kind of passive acceptance of whatever treatment they're prescribed, and then women have to recover from C-sections and never really are told that they didn't really need that. So this shows that's how invasive that is, and then I'm going to move on from that. So leaving women uninformed. I kind of touched on that with the C-sections, but it's in a lot of women's medical care. If you're familiar with hormonal birth control, so that has a lot of negative side effects, and if you have ever taken it, I was going to bring in a paper of one, but it's a paper like about like this big. It like folds out, and it shows you like every side effect you can have just like off the top. It's like blood clots, so heart attacks, strokes, high risk of depression, emotional issues, nausea, vomiting, things such as this. And this is one of those sheets. So before, doctors would prescribe hormonal birth control, and it was never mandatory to tell women possible side effects of that. So it became mandatory after a legal trial that went all the way to the Supreme Court in the 70s. And one of the dissenting physicians who didn't want to have to inform women on the side effects said, "A misguided effort to inform such women leads only to anxiety on their part and loss of confidence in the physician. They want him, the doctor, to tell them what to do, not to confuse them by asking them to make decisions beyond their comprehension. The idea of informing such a woman is not possible." So, physicians, there's a trust placed in a physician that they know things that you don't. Obviously, they went to 8 years of school. But the assumption that you're just supposed to kind of just take whatever and side effects don't matter, and that the physicians, the male physicians, are supposed to just exercise that power. Like, the authority dynamic between a physician and a patient doesn't make doctors good doctors. But you, like that, what we're seeing in terms of, like, the medical field is that there's a lot of, power abuse towards women in that they don't know things, and then also there's like the social expectation that they're just going to passively accept what they're told. So it causes women who, in a lot of cases, shouldn't take birth control for whatever reasons, to be prescribed birth control, not told their possible side effects, and then, they have to suffer the consequences of that. And then minority groups of women. So already obstetric violence is an issue, but to be a minority compounds that, and that's disgusting. So the already existing rate for white women to die within 6 weeks of giving birth, if you're an Asian woman, that rate is 1.8 times as high, and if you're a black woman, you're 3.7 times more likely to die within 6 weeks of giving birth as a result of physician malpractice. Also, any research that we have on the experience of women in medical contexts, specifically the negative experiences, that's all centered around European or American white women. So often the perspectives of women from other geopolitical spaces appear only in the literature on maternal mortality, childbirth abuse, and public health literature on maternal health, with their experiences homogenized and othered. So whatever we are teaching our physicians about how women are being treated, there's a little subsection for minorities, and it's like, oh, and it's kind of worse for them, and then you just speed on past it. To not acknowledge these issues is to perpetuate them. So that's why these rates are so disturbingly high, and it doesn't look like they're going to go down soon. So this is the research gap. So of the $86 million rheumatoid arthritis budget for the NIH, 7% goes to women. 93% of the research budget is put towards studies done on men. Of the $444 million coronary artery disease budget, women only see 4.5% of those studies. The rest is men. Alzheimer's research, only 12% of that budget goes to women. And for lung cancer research, only 15% of that budget goes to women. This is a problem because on the cellular level, women and men are different. So it's not like the research applied to men really can extend to women. And I'll get more into that on the next slide, because this is the skew for statistics on certain diseases. So 80% of Americans with osteoporosis are women. 1 in 5 women will have a migraine disease compared to 1 in 16 men. Women are twice as likely to die of a heart attack and twice as likely to be diagnosed with depression. The heart attack statistic is the one I want to focus on, because physicians are taught symptoms of a heart attack that are now known to apply specifically to men. Heart attacks, when you're told like to look for the chest pain and all that, that's how it manifests in a man. Women, most of the time, you're going to experience shortness of breath. But a lot of the times that's actually attributed to a panic attack, and then women are thus twice as likely to die because they're misdiagnosed. So when you're not doing studies on women for medical issues, the women are more likely to face fatalities as a result of those medical issues. And then also just things such as osteoporosis and migraine disease, if they're not being researched, they don't have something that can treat them the same way that men do because hormones are different, so medications will react differently. So there was a study done in South Africa on the emotions of women in the maternal ward in like a certain hospital or multiple different hospitals. But they came out with a lot of quotes that were kind of heartbreaking, but broader public health literature in South Africa, and this mirrors public health literature in America. Good patients were actually defined. Good female patients were defined as compliant, docile, clean, and obedient. So when you have a patient come in and she's HIV positive, she's black, she's poor, or she's very young as a mother, doctors did this thing where they would publicly humiliate them in front of each other. So they would take the form of degrading comments about the women or girls' sex lives and petty humiliations, which were sanctioned and justified as a form of moral correction. So often women from poor backgrounds, different ethnic backgrounds, are just blatantly mistreated or blatantly, bullied is honestly the word, by their medical providers, which is not really an issue that you see on like the man's side of medicine. Especially this is an issue for obstetrics because young mothers especially face this because they'll just be, there's no good way to say it, but shamed for their behaviors that may have led them to this point. So hierarchical power relations embedded in Western medicine often require the enactment of the prescribed roles of expert patient in which the patient becomes a passive and obedient patient body. And this is a pressure felt specifically by women because there's an expectation that women will quietly accept whatever they are told by their doctor, not question their treatment plans, and thus they are unable to really fight for their own medical needs. Oftentimes, women's symptoms are written off as hormonal or emotional dramatization, resulting in heightened disease progression by the time pathologies are actually acknowledged. One of the women in South Africa said that I think she had like postpartum bleeding or something that was abnormal, and she actually like almost died from it. And her nurses were like, "Why didn't you tell us?" And she had told 3 different rounds of nurses, but she had been accused of nagging, which is an age-old pejorative for women. And when you can't tell your doctors that there's something wrong with you because then they tell you you're nagging them, that's an issue within itself. So when women can't fight for their own medical needs out of a need to be docile and conscious of their nagging just to avoid physician abuse, there's an issue with that system. So a lot of times in specifically like endometriosis or PCOS, endometriosis is kind of what I'm going to zoom in on because that's closer to home for me. But you have like really bad period cramps or you feel really sick all the time, and you'll go to your physicians and you'll be like, "I feel like death all the time," and they're like, "Oh, that's just periods," or "I'm really, really, really emotional," and they're like, "Oh, that's just periods, like just cope with it." And if you leave endometriosis unchecked for a long enough time, like it causes infertility. So to constantly have to fight for your physician to believe that you're not just being dramatic about your period cramps just to get like medication that honestly can save your fertility and change your entire life, like that's, anyways, yeah. So physicians tend to not believe women saying that they're being dramatic about their symptoms, and oftentimes women have a higher pain tolerance than men in the first place, but it causes more advanced diseases in women, especially with things such as like uterine cancers or things like that, because physicians just don't believe them. So the biblical perspective on this, Genesis 1:27. So God created man in his own image. In the image of God he created him, male and female he created them. I don't think it gets much more clear that men and women are equal under God than in this verse, and I think that to not treat them as such as physicians is just a failure to understand the Bible. And then in Luke 8:43-48, Jesus heals an unclean woman with a bleeding disorder. So she had been cast out of society, bleeding long term, and she went to Jesus, and like she had been completely shunned by everyone because of something that she couldn't help, and it was a medical need. And Jesus didn't question her or didn't shun her like the rest of the people had. He just healed her. And I think that that speaks directly to physicians who are the healers of our society, that you're not supposed to question women, or you're not supposed to make them feel bad for issues that they can't help. Like, you're just supposed to heal them. It doesn't get much more simple than that. As Christians, we're called to live like Jesus, and if he set such a clear example, we're called to heal just as equally as he did. And that's all I have.
Okay, great. Want to open it up to our guests. Ladies, do you have any comments or questions for Madison?
So I'm wondering, you did this research and obviously a problem. You can't be the first person noticing it.
Mm-hmm.
So are there people doing anything about this? Or you think it's just going to continue to be one of those problems that's out there and nobody's going to do anything?
So there are organizations that raise money specifically for research on women's pathologies, diseases, whatever. But they are most of the time private. There's like movements to try to get the state or like the government to divert more of their funding towards women, but we're moving upwards, but like not fast enough because these things are still growing and there's still not enough research being done. But and then like researchers are publishing books. It's like becoming more talked about, specifically in like obstetrics and gynecology, some medical mistreatment there. People are coming out and talking about it because it's like that field was started by men. So a lot of the procedures that are done could be done better, and they're starting to become strides made towards that. But
How has this impacted you and what you're wanting to study in the future, or what you're wanting to do?
so I got to intern with an OBGYN, and that's what I want to do. And there was this one woman who came in when we were there, and she had uterine fibroids, which had like been really advanced, and they were causing her like intense pain. And she needed a hysterectomy because they just kept coming back, and they had the potential to be cancerous. But the hospital has so many systems in place that don't let women get hysterectomies or procedures that would cause infertility until they've had X amount of children and their husband's consent. So they had to like make up a cancer risk for this woman, and she was like crying in the room. And she was like, I've been in pain for so long and nobody listens to me and nobody will give me the treatment that I need. She had tried so many different things and nothing was working. And the doctor that I was working for was like, yeah, like I know this is the only thing that can help her, but it'll probably be years before she can get it just because she hasn't had kids yet. And like that just broke my heart. And that was when I decided I wanted to go into the field, because it's just like those kind of system inadequacies, they can't like keep going. But that was the hospital system. Like it runs deep, so it's a problem.
And on that note, like, Madison's got the brain for medicine, I think apparently. I almost said obviously, I don't want to assume too much, but like, you got the mind for it. For those of y'all that are like, I'd never be a doctor. Doctors' offices, hospitals, they run on a massive administrative branch that if you're an accountant, hospitals need good accountants. If you're a business manager, hospitals need good hospital administration. I'm talking about like getting people, like this goes down to practical stuff and like what she's saying, there are, my wife right now is waiting on a medicine that helps her tremendously, but there's a back order because of some shipping issues. Doctors are like, yeah, we'd love to give you this. So all that to say, like, what Madison's speaking to, what Mrs. Evans is talking about, this is a problem. What's being done about it? It's more than just, like, Mike, I have some questions about doctors particularly, but for those of y'all that are, I'm not saying anybody's disinterested in it, but for those of y'all that are kind of keeping this at a distance, thinking, oh, I can never really impact that. No, like, remember the whole idea that what you, the bit that God has given you, the talents and abilities God has given you, maybe there's an inroad, maybe there's a way in which these types of problems could be solved. Anything else?
Good job.
Thanks.
All right, so I feel an obligation to do this. Gentlemen, let me talk to you for a minute. And there's only a few of you in here, but gentlemen, let me talk to you for a minute. This is one of those issues that if you're not careful, you're going to find a way to not care about this. Our culture, right now, the temperature in our culture is one that if you're not careful, you'll let your conservative political leanings interpret this as some type of feminist this, that, or the other. And I know because we've already had that in some of our ladies' presentations this year. And I just want to squash that as quickly as I possibly can. Should God decide to bless you at some point in time, you're going to have women in your life that open your eyes to the fact that they deal with problems on a daily basis, often moment by moment in those days, on a daily basis, that you will never have to worry about. You just won't. But if you care deeply about a woman, you're going to care deeply about the things that she cares about. Does that make sense? My mother-in-law was given a cesarean section with my wife. You can't say it was against her will because she was never asked. So she never had the option to say no to it. I'm sparing you the details, which means that my sister-in-law 7 years later, just by default, has to be born by way of a cesarean section, which is a major surgery. A doctor is reaching into this woman's body. Also, she almost died on the table. My mother-in-law almost died on the table while giving birth to my sister-in-law. Right now, she's trying to figure out some stuff that's still going on. And my sister-in-law is 30 something. This is an ongoing problem. Now, granted, my father-in-law is in the military, and so they were given Veterans Veterans Affairs, TRICARE, medical, whatever. And it was some surgeon, and I'm going to try to give him the benefit of the doubt. But this is one of those things that hit very closely to home. We've been blessed with good doctors, my wife and I. But I'll tell you this much, there are things that she's just now getting figured out. Having moved to South Carolina, she's found a wonderful doctor that I wish we would have found earlier, because she is finally getting things worked out. This has nothing to do with the reproductive stuff, but just to give you, just to testify to what she's talking about here. My wife is allergic to penicillin, so she can't take antibiotics as normally as she would like. She had an inner ear infection, but the doctor said it was sinuses. The doctor tried to convince my wife that it wasn't an inner ear infection, that it was sinuses. You're blowing this out of proportion. I don't know that he ever used those words, but that was the impression that she came home with. Okay. Punchline, my wife has about 30% hearing in her right ear, because this inner ear infection that she had for about a year and a half, it went on, killed the nerve endings taking hearing from her. Now, I understand that's not the biggest thing in the world, but when Madison's telling you that women just aren't believed by doctors, this is a common experience. Like this is not something. I'm sorry I feel so strongly about this, but again, like last week, I heard some feedback from some other presentations that have already been given, and the word rant was used. Shut up. It's not. This is factual stuff, and so maybe the reason why it seems that way is because you just haven't had the opportunity to have anyone close enough to you to care about this kind of thing. Anyways, now that was a rant. Okay, in case you're wondering, that was a rant. Okay, I'm admitting as much. Questions? Rant over. With Caroline's presentation, was that this week? I'm getting my days mixed up.
Mm-hmm.
With Caroline's presentation, my impression was, why are men even being allowed in this field? She gave a good reason, that there's a legitimate reason for it, just as long as they're not being creeps. With any type of obstetrician, gynecology, and really for that matter, medicine in general, questions twofold. Number one, what are the numbers in terms of women going into medical fields, whether it's general practice or whether it's specialized areas or whatever? It's a really important part of the story that medicine was a very male-dominated field, and I'm guessing still pretty much is. So tell us a little bit about that, like more and more women getting into the field of medicine, and then also, is this a field that just needs to be taken over by women? Is there any benefit to I don't know. I don't want to be too hard on men in this, but it's just like, I'm not sure that men need to be particular. Well, I'm gonna shut my mouth, but
Yeah.
can you speak to that at all?
So we're seeing a lot more female physicians like that. The numbers are actually pretty close, so that's looking good. But for gynecology, it's like 80% women, like female physicians, which is actually kind of funny because one of the old men on the board like is quoted as saying, and I almost put it in my essay, but I didn't have anywhere to put it. But he said it's a shame that gynecology is becoming a field run by women because it's losing all of its validity. Which, anyways,
When was that statement made?
oh, I want to say in the last 10 years. It was kind of wild. But so with male gynecologists, male obstetricians, like there's a lot of times there's a question of motive because it's like, why are you doing this? Because I mean, you're one on one in a room and a woman's in a vulnerable state. But I personally, on my J term, I worked with a male physician, gynecologist, and he was a good doctor. I think if you're passionate about it, because I think he had experienced something with a loved one that just made him want to help other women in that position. Um, if you're in there for good reasons, by all means, but there's a really troubling number of doctors that will sexually violate women in exam rooms. Like that's a problem, and so I don't think it should be like barred from men because if you're an expert on a topic, like by all means, come make the field better. But if there like it does breed that kind of opportunity for abuse, if that makes sense.
Well, and I appreciate I appreciate the generosity that, yeah, if you're an expert, then by all means, like you said, yeah, I'll keep my thoughts to myself. Another question I had, as far as the research is concerned, you had like the research gap that you talked about. Was that research on or for? Like is it? Can you go back to those for a second?
Yeah.
Or yeah. So.
Oh, the
one more.
research.
So on those, is this research money going, like you say budget and all those, is that research money going towards women doctors or research money going towards research being done on women?
It's the disease in women.
Disease in women.
This is all from the NIH.
Okay, got it. I just needed some clarity on that. All right, cool. Classmates, you got anything from Madison? Mills?
Is this like an issue that's just more like male to female, like male doctors to female patients, or is also like seeing like female doctors to female patients?
So internalized misogyny, that's an issue for a lot of women, just like in general, but that also extends to female doctors to female patients. Actually, it's really kind of heartbreaking, the statistic on young women, like young pregnant women that are mistreated. Like a lot of the times they're getting bullied and abused by female doctors and female nurses. So it's not really so much a like, I mean, obviously, like, the majority of, like, larger scale, like, sort of, like, sexual abuse situations, that's kind of more done by men. Obviously, women can still do that. But it's more just, like, an institutional issue, like, embedded within the system, more so than it is, like, men come in with personal vendettas. They're just, like, taught, like, oh, women aren't going to care, so just kind of do whatever's more convenient for you, if that makes sense.
Good question.
Kate.
So it seems like we as a society aren't like very well informed about issues like these. So how do you think we can become more informed, and how does this affect like the future of modern medicine if we are more informed?
Yeah, I think that textbooks are gonna have to be rewritten. That psychiatric writing, like that can't keep flying, you know. Also, there's gonna have to be like an acknowledgement, and that's kind of like mold grows in the dark. Nobody's acknowledging that this is an issue, so it's growing. I think that if you go from the base level of like med school, and you stop teaching that women are just going to passively accept, and you stop teaching expectations for female patients, then you're going to see a growth. Also, if you just kind of give more research money to studies on women, then you're going to make that rate go down for fatalities of diseases. Or if you just start teaching your physicians not that women are hormonal and emotional and you can never predict them, but that you teach them that take a woman's symptoms as seriously as you would take a man's, then we're going to be more informed, we're going to be more aware, and you're going to see like a decrease in like the the advancement of diseases like in women relative to that of men, if that makes sense.
In medical school, do doctors, in the process of the training at some point, are they, we've had conversations about, like gene editing and stuff like that, and bioengineers are not being taught philosophically what ethical practice should be. Do doctors have to get any type of ethical training, any type of?
There's like ethics, I mean, because obviously like things such as stem cell research and stuff like that, like that's ethically kind of gray. So there's like ethics training. I think there could probably be more done to like to specifically this issue, but like the medical field is, I don't want to paint it as just like still back in the dark ages of when it was like they were lobotomizing women. Like it is moving forward. It's just not forward enough to really recorrect as much as we need to, if that makes sense.
Cole, you got a question?
Yeah, this could be a dumb question, I just don't know much about this, but this kind of goes into health and mental health, so do you know or think that when C-sections are performed, that it can cause a greater percentage in postpartum depression, because I know the added recovery and just that whole process can add more stress on the patient?
So I don't actually know like any statistics to cite for that, but I'd imagine that would be the case because you're kind of more immobilized and it's highly invasive, especially if it wasn't clearly medically indicated or if it wasn't wanted by the patient. Because a lot of the time women want to have natural births and they have to have C-sections, but if it's not blatantly needed and the physician's more just like, this is what we're going to do, now let's, paralyze you from the waist down, that would have some sort of trauma with it, and a lot of women do because you are awake for that. So like you're kind of like fully aware and like moving your head that your whole abdomen's wide open. So there's like an element of PTSD that some women face. I can imagine that would increase your risk of postpartum depression because that's a trauma. Like you don't have a lot of surgeries you're awake for, and that's a very intense one.
Should be done about the C-sections, because I know that most C-sections are by definition an emergency surgery, and because, whenever a baby is taking a long time to be born, they have higher risk of not breathing and developing, permanent brain damage. Why do you think that, is it necessarily a doctor's, issue with being biased against women, or do you think it's just them acting as a precautionary measure to prevent brain damage to the baby?
Yeah, and like I said, when I first presented it, a lot of the times it's medically indicated, and that would be one such case when the baby's in for too long, and it's it's to save the life of the fetus and often preserve the life of the mother as well. But the problem with the C-section performance, or the issue with that procedure, isn't that it's done, it's that it's done too often. Because a lot of the time, doctors will pull that card and they'll be like, oh, you've been in labor for too long, let's just do a C-section. But it's because the doctor wants to go get lunch and can't leave the hospital till that baby's born. It's not, C-sections are a great procedure. I'm so happy that we discovered we can do that. That's not the issue. The issue is they're done too often, and they're done when they're not fully needed, if that makes sense.
They're being showcased as an elective surgery, and the insurance companies get more money if a woman has a C-section versus a natural birth.
Yeah.
So the business side of hospitals are kind of taking over in some of that area, and they're showcasing it as, hey, this is an elective surgery, you can be in control. And that's not really the case.
And that's another problem too, just from my J term speaking again. Gynecology wards or obstetric wards aren't as funded as sports medicine or whatever, so they don't have as much help. So doctors face pressure from their hospital administration to do procedures that cost more or would make the hospital more money, and then they're incentivized to do that, and they'll be like, you'll get more nurses, you'll get more help. So it's also from the top down, this is a bigger issue than just one doctor comes in, screw women, let me cut them open. You know what I mean?
Yeah, so many of these, and that's the issue is I think that a lot of people kind of like, a lot of Christians like to view these issues as individual problems, as though there are these doctors that are just, as Stephen said, like biased against women. It's not really, like that's an issue, but this is a systemic thing. Like this is something that is built into it that, like Mrs. Evans was saying, it's like, yeah, but if a hospital knows they're going to get a bigger paycheck by doing this and the other, just like a restaurant says, hey, push the whatever because we're going to get, then the money ends up being the determining factor as opposed to the woman's well-being, and that's injustice. Like that's just wrong. Anything else? We got a minute, Joseph.
So this is definitely a prevalent issue, and after you've heard personal testimonies from people that they really care about this kind of issue, but like, what's your thoughts on how this bias came to be?
I think that you just kind of, like in the beginnings of like history, I mean, women were viewed, as lesser men, and then like that psychiatric writing that they're potentially warm-hearted creatures that are just failed men that are mourning that failure. I think that it's more just like a early issue, like women couldn't vote for forever, like it's like a historical thing that was sanctioned and now it's continuing to be kind of sanctioned, if that makes sense.
Yes, but like, it's historically sanctioned, so why is it historically sanctioned? So,
I don't really know, but women have kind of just historically always kind of been seen as lesser, I don't know.